father and mother both had diabetes, and about 6 or 7 of my siblings now have diabetes in various degrees. And some of them control it entirely with diet and exercise, and some of us have to have medication. My father was diagnosed at age 55, I was diagnosed at age 33, so I had an early start on taking care of myself.
It's critical for patients to take an active role in their health. And I think from a provider standpoint, one of the things that we should really spend more time on is engaging patient interest in the beginning of a conversation about their health. Because if we can get them to engage us even a little bit, and we make little steps towards getting them more involved in their own health, then I think we can make a big difference. It may take 3, 4, 5 visits to get a patient to start engaging me. Instead of just jumping to giving recommendations, well, you really need to do this and this and this and this. Waiting for the patient to engage has been a key element in the success of the patient really engaging their health care and then moving forward together as patient and provider. It's been extremely successful. We've had a lot of patients who, when they do engage us, have gone the full mile and completely turned their lives around.
Well, I started out by going to my doctor, and he found out that I had diabetes and put me on medication. And then I was in Louisville at that time, living down there, and then I moved out here and I started going to Dr. Sonson, which I was still on my medicine. And so he kept me on it. And then I joined this program. He wanted me to be on the weight program. And then he told me if I stuck with it, then I could get off my medicine, which I have. So I've been off since August. And I keep it under control that way. Before I started the exercise program, I did yard work at home, and I cut my grass. I used push more in certain areas where I couldn't get the riding more. And I do gardening, work in my flowers, make flower beds, move bricks, put bricks around my flower bed. So, and I walk and take the dogs walking. So we walk about a mile.
I was asked to take a glucose tolerance test to find out what shape my diabetes was in. And from there, adjusted diet and removed all sugar from my diet, cut down portion size, lost about 30 pounds, then did exercises, eventually had to go on medication, and medication was adjusted from time to time depending on my needs. The exercise program have helped me maintain over 32 years. I started a new job 50 years ago yesterday, and I weighed 212 then. This morning I weighed 213. The first step is to have the stress test to see where you fall in the diabetic program, and then get a competent diabetic educator to explain all the things that diabetes does to the body and the best ways to control it. And of course, exercise and diet are the main parts of it. The medicine is to help you control it.
I'd say your first step is to go to the doctors and be checked out and see what your problem is, and then follow your doctor's orders and take your medicine and learn how to eat and control it that way, you know. It's for yourself. You're doing something for yourself.
The program here showed us the 9-inch plate, which was used to demonstrate the amount of food and the types of food that we should be eating. And I used that example to show my wife that where we should be. And she adjusted and we're doing fine. Ever so often we need to be reminded of what portion size really is. And I pay close attention to that now.
I was amazed at all that I saw on them charts about how much diabetes can affect your whole body. Some of that I didn't know, you know, such as your brain, your pancreas, and all that. I was amazed at that. So for me, I have really enjoyed the program. I learned a lot of things that I really didn't know, and some that I did, but some that I didn't really focus that much on. And I would recommend it to anybody, you know.